Skin cancer remains the most common cancer in the United States, despite preventative skincare measures like sunscreen use and UV protective clothing. Rates of melanoma, a type of skin cancer, have been increasing steadily over the past 30 years. Melanoma can be mostly treatable when it is caught in its very early stages, but survival rates can decrease as the disease progresses. So here to tell us more is Dr. Jason Luke and Kylie Lapira. Welcome to the show, you two.
Great,
Hi.
thanks.
Thanks for having us.
No problem. Okay, first question is, what is advanced melanoma?
Yeah, thanks so much. So again, Jason Luke, and I'm a cancer doctor taking care of patients with melanoma, but also a researcher and consultant to companies like BMS. And I'll note that BMS is very generous supporting groups like the Melanoma Research Foundation as well. In terms of melanoma, we commonly think about it as skin cancer. And as you noted, the vast majority of patients can be cured of it if we catch it early and it's removed from the skin. But about 8,000 to 10,000 people per year in the United States will develop what we call metastatic or advanced melanoma, and that's when melanoma spreads from the skin to other organs, the lung and other places. And that then we have to think about trying to give treatments to try to control the melanoma, hopefully shrink it and make it go away. In that regard, immunotherapy has become the backbone of treatment over the last 10 years or so. And this is where the Opdualag medicine, this new treatment that we're going to talk about, is coming in as a very exciting approach to try to treat patients with advanced melanoma.
And tell us about this new dual immunotherapy treatment option. Why is this an important advancement for patients?
Yeah, so absolutely. So this new treatment, Opdualag, brings to bear two different medicines in the context of one treatment. And these two medicines target different proteins that we think limit the natural immune response from fighting cancer. And so in a clinical trial of Opdualag, what we observed was more than a doubling in the amount of time that the cancer was controlled. And so that's a very powerful finding. It's worth noting that no cancer treatment is without any side effects. And so it's very important then, in considering whatever treatment, that a patient and their family members talk with their doctor and treatment team about what the best treatment would be for them.
How has immunotherapy changed the treatment of advanced melanoma over the past decade?
Well, like I mentioned, so trying to choose which treatment will be best for an individual patient really should be up to the patient with their doctor. But immunotherapies have a lot of potential to potentially shrink the cancer and keep it at bay for longer periods of time in a way that's a sort of different way of thinking about cancer treatment versus what we've standardly thought about, say 10 years ago.
Where can our viewers go for more information and learn more about it?
Great question. So there's a couple of resources that I'll touch on. But first, I want to give a shameless plug for Melanoma Awareness Month. This is a really important topic to be touching on during the month of May, especially for a cancer that is very treatable if caught early. So here at the Melanoma Research Foundation, we have a great campaign called #GetNaked, which is about checking your own skin and seeing a board-certified dermatologist. And for resources for patients who have been diagnosed, the Melanoma Research Foundation has many resources at melanoma.org. And again, going back to the treatment that we're very excited about because it gives patients an option, which is really important, which here at the MRF, we believe that brings a lot of hope to the patient community. And they can find more information at opdualag.com to find out more about that specific treatment option.
Thank you two for joining me this morning.
Thanks so much.
Thank you.